Welcome to Let's Talk About Health, an informational podcast that gives you insights on health and fitness from experts themselves that you can apply directly to your own personal health and fitness stories. Come join me today to hear all about what they have to say on health and fitness. So let me introduce you first. You are an athletic trainer. You've worked as a coach. You worked in sports. You have worked in fitness and training for so many years. Sir, how would you say, or how would you go about defining health and fitness? Is it the same? Is it different?
I think you got to say that they're different, just because health can mean so many things to different people based on where they're at in life. I think and then same thing with fitness. You know, you talk fitness for high-level track and field athletes is completely different fitness for not so high-level athletes, and whoever it may be. So that something to take into consideration. As most people probably know, there's so much nuance that comes along with that, based on the individual and what their goals are, that they're different, and even within their own definition have to be different for each person.
Right. How do you personally approach fitness? How do you personally how do you stay fit?
That's a good question, and I think my wife, who might actually be watching this, will probably laugh at me. It hasn't been as much of a priority as it should be over the past couple of years, and that's mainly with kids getting introduced into lives, other interests, going back to school. So for me, it's just trying to make sure that we're doing as much as I can to get the maximum benefit. So trying to find things that work, but not making it so it's running it into the ground. I used to be, go to the gym hour and a half, 2 hours when I was in college and coming out of it. And now if I get 3 45-minute workouts in during a week, that's pretty good for me. But trying to make sure that we're getting it on the back end, trying to watch some nutrition things or some other health related things. I joke about it even with people that I work with now, and just the different populations is, part of the reason I still work out is I enjoy things like pizza and beer. Like I want to be able to enjoy those things, but also at the same time make sure that I'm not going off the deep end.
And if I'm not wrong, you're from Texas.
No, originally from Minnesota.
Oh, Minnesota?
Yep, I've lived up north my entire life, but lived in Oklahoma for a couple of years.
Oh, that's so cool. It must be getting so cold out there.
Not yet.
Not
We're
yet?
still in for Fahrenheit this weekend, which is pretty warm for this time of year, but it could also be snowing in 2 weeks. We just never quite sure this time of year.
Yeah, that's true. It's just something that, up north, you never know. It can be
absolutely
in the morning and snowing at night.
Yep.
Yes. So how do you go or approach fitness for your clients, for your athletes, for people you work with? How does that plan take part?
Yeah, so primarily now the group that I work with the most is a local fire department. We do some of their fitness training, which has been a unique challenge because we're only really planning their fitness for the 2 days they're on shift. So they work for 48 hours and then they get 96 hours off. And so trying to figure out how to complement fitness back-to-back days gets difficult, and then not knowing what any of them are going to do on those 4 days, we just kind of let them do their thing. But more recently, the focus has really been on a movement-based program, making sure that we're addressing the big movements, not so much worried about maximal strength all the time, especially with this firefighter group. It ranges from 21-year-olds to 55-year-olds. So we got to take all of that into account. But what we found to be effective with them, and even previously when I worked with some collegiate athletes, is a lot of movement and then building in some mobility and some accessory exercises as a superset in their lifts, because it's efficient, which is good. We're addressing the things that we want to see, but we're not requiring them to do an extra 15 minutes or 30-minute session of something. And so you're building that right in, and you're getting people to all of a sudden be like, my shoulders feel better, my hips feel better,
Right.
but it's within the context of something that they were going to be doing anyway. So that's been really eye-opening for me, and I try and build that into anybody that I work with is, hey, we're going to address all the big things and hit your goals and whatever those may be, but let's work on some of this other stuff, because I think you're going to see the benefits of it, and again, it's not going to take you any more time to do it.
How is it different from working with athletes? I know you mentioned like the days and the hours,
Yep.
and being cautious with overexerting them, but how would their protocol, their exercises, their diet be different from regular athletes?
So that's the nice thing about athletes, and I work primarily in the collegiate setting, so everything was very defined about when things occurred, is you have a very defined in-season, right away off-season, a long off-season, then kind of a preparatory phase. And so you're able to plan out knowing what to expect during each of those times. So we're not going to do the same workout, say we're working with American football. In the middle of October, they're in the middle of their season. We're not going to use the same workout in October that we would in March. Excuse me. With firefighters, there is no off season.
Right.
Excuse me.
That's okay.
So we have to take that.
Right. In consideration.
Exactly. Sorry. Wow.
I see the allergy seasons have started.
Something like that.
Yeah, in New York, it's been so bad. Like, I'm dealing with patients out of an outpatient, and the main complaint is not pain anymore, it's allergies.
Right.
So we're just trying to go step into fall, but the winds are not being easy on us. Yeah, it's just cold.
Absolutely. So back to the firefighters, there's no peak or valley in their year. They have to always be ready. We do try and program to allow them to have a harder time and then bring it back down, but we have to, like I said, be very aware that we can't crush them in the morning not knowing that they're going to get a 6-hour fire call later that day, because you never know. And so finding that balance, and we really tried to make sure that when we started with them, we really ramped it up slowly to try and build a really good base so that we could do those more intense periods, but still have them be able to do what they need to do.
With fire, is there a schedule for their workout with firefighters? Or is it like every day they just have, all of them have to train? Or is it just that those who are on duty don't get to train that day, they get to skip that day, something like that?
So it very much depends on the department. Our department that I work with used to be on a 24-hour on, 24-hour off, 24 on, 24 off, 24 on, 4 days off. And so that made it easier to program because you had those spaces in there. But it used to be on their own. It was up to them if they were motivated to do it. But then they got put into their actual work day, an hour of fitness as a requirement of their work. So when they're on shift in those 2 days in a row, they, by kind of work rules, have to have an hour of fitness each day. So that's made it a little bit easier for the compliance. Most of them were excited about that because it brings them, it like kind of forces them in a good way to do it together. And so that's been really beneficial for them.
Right. Talking about motivation, what are like the tips and tricks that you use personally to keep them motivated, that no, you gotta get up, you gotta work out, you gotta stay fit?
Yeah, so one thing with the firefighters we did when we came in, and we had kind of an interesting interplay with our occupational health group within our health system as well, is that group is looking at that as a occupation, as a profession, which is not wrong by any stretch of the imagination. but we took the approach of, we were looking at it as, you're a tactical athlete. And because even someone were like, well, I'm not an athlete. Like, yeah, I understand what you're saying. Like, not playing on TV, but at the same time, the requirements of your job, while yes, sometimes it is very low key, and that's hope for it, you are putting out some serious effort, and we've been able to do some quantification of that through some research that we've been doing with them as well. Is just truly trying to understand the strains and the stresses that go on, and so trying to approach it that way of like, we want you to hit your goals as well. So talking to each of them kind of individually, like some of them are just like, my back's been hurting for years. Is it, you know, can we build some stuff in there to help that, which we've done. We did some individual movement screening with them that then generated their own personal kind of maintenance, in quote, program, if you will, which allowed them to then be able to compare it to their colleagues and be like, oh, I'm doing something different than you. So it was truly personalized. And I think that helped with buy-in a lot as well, of just, it wasn't just this blanket thing that, you know, nobody was around. And then honestly, they've had people try before. Just showing up and being around to answer questions has been like the biggest thing with that group.
Right. Are there any misconceptions that you've heard about health or fitness towards training the firefighters that you just want to clear the air?
With that group, they seem to they make fun of themselves about how poorly they eat and how things there. And, you know, it's that misconception that like being healthy has to be expensive, and or it has, you know, in terms of food, because they do a lot of cooking together. That's a very much a big camaraderie thing within that profession. It's like, you know, butter and cream cheese aren't the things that have to make everything taste good. Like, there's other options we can do that are still cost effective, that is going to be healthier for you in the long run. And even with some of the workout stuff is, you know, I guess going to that, and it's a bigger picture overall. Like, there's a difference between working out and training. Anybody can do a workout, anybody can make you tired, anybody can make you sore. You can find anything like that on the internet. Truly training to build up that capacity in your body's ability is different, and it can be easy at times, and that's kind of a hurdle that you have to get over with them. And even a lot of athletes, is just making sure that they understand it's a progression, because that's how your body adapts. And the goal, you know, if you didn't get sore from it, it didn't really do what you wanted, is a hard misconception to break with people. And I was one of them as well in my early days.
We call it the good pain.
Right. There's
Yeah.
a place for it, absolutely, but I don't think it can be every time and in every place.
With the soreness, with their training, specific training for firefighters, what are the main aspects that you look into, or you have to train them just specifically for firefighters?
Really, for them, it's a lot of just general preparedness for fitness. We have focused on a lot more unilateral work, split stance variation work, you know, using opposite sides, just because the tasks that they have to do are so variable. You know, in a lot of sports, depending on your position, it's a lot of repetitive motion. You kind of know what to expect depending on what it is. You show up on a scene of a car accident or a fire, you may have a preference of what you want to do, but you might not get that preference based on the situation. And that's a few other things we found through research. A lot of them have some significant force imbalances between right and left leg, and some movement imbalances between right and left side. And so we've tried to make sure we focus on those unilateral differences, and really that type of training, along with some rotational stuff, just from having to, you know, rotate or anti-rotate while using a charged hose or throwing a ladder, or all the different tasks that maybe by isolation don't seem like a big deal, but again, if it's a long call and a lot happening, it can add up quickly.
With the unilateral, if there is, because I had done a research in my bachelor's long time, but I remember we were training. The research was about jump. So the takeoff and the landing.
Yep.
So it's always biased. Like one leg will always take the lead.
Sure.
But that was the research conclusion, that there will be one dominant leg, and well, we wanted to take it forward to as to how we can train. But I will always wanted to know, with training unilateral balance, do you train both the legs as equal, or do you just focus on one leg, and what variations you do with exercises?
Yeah, so we decided not to use jumps in our case, we would have loved to, but there's a couple of the firefighters that have a history of Achilles tendon rupture, and so we didn't want to contribute to that. So we actually isometric mid-thigh pull on force plates to see which was just a little safer test to use. I've heard a lot of different things going back and forth, and I just heard something the other day where I questioned it a little bit. It may have been one of the doctors that I actually work with, of like, oh, if you're doing unilateral stuff, just do some extra sets on the leg that's weaker. And I don't know that that's the right answer for me personally. I go more along the lines of, we're going to train them about equal. Maybe we add a rep or two, but really we want to make sure we're bringing the weight along and making the quality of movement identical. I don't, as much as it makes common sense that if one side's weaker, or like you said, isn't the dominant one, we want to hyper focus on that one. I don't know if I've read it through science or somebody else that made a really compelling argument about it, but it just doesn't seem to be that simple that you just train at a little bit more and all of a sudden they're going to be equal. I think it's the quality and the intention of focusing on the non-dominant one, or the one that's not as strong. Can there be times and places where you focus on the leg post-op ACL? Yeah, you want to focus on the operative leg to kind of get it back to baseline. But once you get there, I think you got to be really careful with overtraining that non-leg, because you may end up setting yourself up for more failure.
Correct. I use this practice. I always train both the legs. Especially, we get a lot of injuries like fractures, hip surgeries, knee surgeries, ACL ruptures. So I make sure that I'm training both, because I have seen my seniors back in college days. They used to just train the leg that has been surgically operated. So like by the end of 3 months, 6 months, the cords are like steel solid. Like you tap on it and it'll stop. It is so solid.
Yep.
But the other leg is so thin.
And there's, to that point too, there's some crossover effect too. I know there's some research out there. I remember the shoulder specifically. If you injure your right shoulder, even in the pre-op process, or as you're starting to get back, still training your left side, there's some 20, potentially up to 30% crossover in strength, even if you're not even using the injured arm, because the somehow is doing it. That's kind of beyond where I've delved into the details on it. But yes, I agree with you completely, because even on that return, we have this argument all the time too, with return to play protocols and strength. Well, if you haven't really been training the good leg in the same, now test them out, like, are you truly getting a good measure, or are you just hoping that it's good enough that the numbers match up enough? And there's not a perfect answer to it, hence why we all do what we do, but it is a really important consideration.
With training, do you focus on single muscles, or you go for like combination of movements?
I try and focus on complex movements as much as we can. We do some of the accessory stuff, specifically with the firefighters and our training, where it's back-to-back days. Day one, we'll have an explosive kind of total body movement, some clean pull variation or jump, something to just really work on explosive power. Then we'll do 2 kind of primary strength blocks, with an upper push with a lower pull, and then an upper pull with a lower push, or some mixture of all of those. We'll do rotational exercise, and then we do some energy system development where we mix in kind of a bunch of different movements. Day 2 is another total body motion or movement for that first block, and then we actually try and repeat 2 more kind of total body movements, just kind of complement each other. And then we'll do some accessory work, and some of that, back to your question about motivation, is vanity, muscles and things like that. And yeah, if that's also part of your goal and that's easy to build in, I'll try and do variations, instead of just bicep curls, we'll do hammer curls. So we're still working on some forearm, strength and development there. So I try and sneak in as much as I can with that. But the majority of it is those complex movements. And then even making those suggestions to them there when you talk about different, row variations for back development. Well, depending on how you're holding the bar or the dumbbell, that's also probably one of your better bicep workouts too, just because you're still getting that elbow flexion and you're moving way more weight. And once you start making those connections with them, all of a sudden they buy in a little bit more.
Right. Do you come across a lot of amputations?
I have not worked with that. One time, and I didn't actually work with the individual when I worked track and field. There was a Paralympic athlete that was training with us who was in the military and had a kind of mid-thigh amputation and was doing some training, but I didn't specifically work with him. He was just at our facility, but it was impressive to watch the detail and the subtleties that have to go through all of that in order to perform at the highest levels.
Right. So your training is just to prepare the firefighter for the event, or is it also to deal with injuries?
A little bit of both. We started with this kind of performance aspect of it, tagged along with the research, which is with a colleague of mine. We haven't formalized the care on the back end with injuries, but if things come up and they do bring it to my attention, because that's also kind of a thing within the firefighters, they'll go through a lot of pain without telling anybody about it because they don't want to stop. And so that's a similar thing with athletes I've worked with, just gaining that trust of, hey, I'm not going to hold you out just to hold you out. Like I will only do it if it's a requirement for your health and safety. But get it to me early so we can figure out how to make this a 2-week thing, not a 2-month thing. And so I'll get a few of those and some questions there. A couple of them have come in and seen our physicians just to get some questions answered and not have to go through kind of the whole health system to get there. They can just get right to the question that they have and then plan for what they need to.
Okay. How are the best techniques or ways you use to prevent injuries?
Oh, that's a big one. Some of it was in the movement screening, just kind of figuring out what to address. I firmly believe the best kind of injury risk reduction / prevention program is a really good training program. If you can address a lot of those things within that program, I think you're doing a huge service for that. That's something we utilized with the college athletes. We did functional movement screen on the entire team. We didn't write individual programs just because compliance wasn't great, but we looked at the larger trends that we were seeing across the team and then built that right into the program of things that we were addressing with those accessory exercises. So again, we were addressing the things we wanted to. They didn't have any clue that we were doing it, but they were reaping the benefit of it. So we were able to back it all up. And then if they ever did ask questions, we could fully break it down for them, which helped increase buy-in there. So really just trying to create a robust individual in terms of movement and work capacity has been our goal. Because, with injury prevention, you can hopefully do some stuff with some chronic, long-term things, but at sports, non-contact things, maybe, but if somebody runs into you or you're in a fire call and you step on something and it gives out, there's almost no level of training that's going to help prevent that. hopefully we make it so you can get back quicker because you're just more resilient, but that's the unfortunate nature of just injury itself.
Right. I agree with you. Yeah.
Yeah, I
How
used to mention a lot, and I've tried to shift myself to saying just risk reduction because I would love to say we can prevent injuries, but again, depending on the situation, I don't have a chance. So we tried to go more to that risk reduction just to kind of hedge my bets a little bit.
just to be technical.
Yeah, absolutely.
How much do you think physical, the psychology and the mental aspect of health plays a role in your fitness training?
I think it's huge. If you've got buy-in that it's going to work and it's going to benefit you, I think that automatically makes things significantly better. Same thing with injury recovery. I know I've talked with different people, and just even the visualization of, if you strain your hamstring, like that vision of, like, all right, the muscles coming back together and the cross bridges are getting laid down and all of that, and just visualizing that healing process can be so powerful to the part of it. And just knowing that you're having that, used a lot of short-term goal setting along the way. Hey, here's what we're going to do. This session, here's what our goal is by the end of the week, and so on and so forth as we build it out, was huge, especially working with athletes, having that goal of like, hey, I think this is attainable. Here's the steps we need to do to get there. And just increasing that buy-in was a big part of the process for me.
How do you introduce diet in their fitness program and in their fitness plan?
We talk about it as much as I can. I try and refer off to people that are way more educated in that than I am. It's one of those things, like, I know enough to be helpful, also potentially enough to be kind of dangerous. So that I walk a very fine line with it, just very broad speaking. I worked with a lot of college athletes over here. And so that was, just even the conversation of like still eating enough when you're injured and that being important to just help the body recover was always a big topic. It's the college lifestyle for a lot of them. So it was always just talking about alcohol consumption. Like, if you got hurt on a Saturday football game, what you do tonight over the next, 24 hours could impact your ability to be ready for next week.
Right.
That's your decision. If you want, and there's a difference, between going out and having a couple of beers or something with your buddies and not remembering what you did that night. Like, those are all really important factors in all this. And so that would always be something we talked about, is just being like, it's ultimately your decision on how you want to approach this. But here are some simple things that could have a really big impact that aren't overly difficult to do.
Right. So what inspired you to get into athletic training and just helping and serving, being such a huge part of the community, to firefighters, to athletes?
Yeah, so I was an athlete throughout high school. Didn't know what I wanted to do in college, just knew something within kinesiology, which I had seen on the outside of a weight room. I heard about athletic training on my freshman orientation. Thought it sounded good because it was combining the medical with sports, and I thought that sounded pretty interesting. So I ended up pursuing that. Went on to grad school to get my master's in exercise science. From there, it really has just continued to grow. I've worked with track and field the vast majority of my career at a very high level. In the U.S., Division I is kind of the highest collegiate level. That's where I spent my time with track and field. But then moved down into a Division III school. So no scholarships, much smaller. The athletes are still very high level, but not to the caliber that those D1 athletes are. Worked football and a bunch of different sports there for 7 years. Loved it, enjoyed it in a lot of different ways. Kind of had a career transition, moving out of that to working in a sports medicine clinic, where we then got presented with this opportunity to work with the firefighters. And it's such a unique group of individuals, and the stuff that they do, and we've really framed it as like giving, like supporting those that support us. Like I
Right.
joke, but somewhat seriously, like I'm not a small human being. I'm 6'3", 275 pounds. Like I'd like to know if I'm ever stuck in a spot that I need somebody to drag me out of. It's going to take some effort. So making sure those firefighters are ready for that type of task is an okay thing, for a little selfish need for,
Yes.
but ultimately, just knowing that you're helping them for what they do for the community is a pretty cool thing to be doing with your skill set and your career. So
That's so cool. I am so inspired by just talking and listening to you about how you get, for selfish reasons, although
yeah.
those reasons. Yes. So who has inspired you? Like who has been your role model throughout your journey to be where you are?
That's a good question. I don't know that I've actually had one specific role model. Had a lot of really great people I've come across in my career that you kind of take a little bit from
Right.
everybody. Good, some not so good, and you kind of build it all together. I think the role of social media has been huge in just connecting with people and constantly getting inspired by them. Similar to you, like you do these Let's Talk About Health. I run a podcast where we interview athletic trainers, and I've got to meet incredible people in all walks of different job settings. And you just, every time you think you're personally doing something cool, you talk to somebody else and you're like, well, they're doing something that's really cool. And it keeps the process going. And so it's really just been that collection of just seeing what other people are doing, pulling ideas from it, um, seeing what people do at the highest levels, in Division I. And when I was at that smaller school, how can we adapt that to here and make it useful for that was always, kind of that motivation and that inspiration to keep trying to come up with creative ways to always provide the highest level of care.
That's very inspiring. Thank you so much for agreeing to be a part of all of
Yeah,
this. And
reaching out and being patient.
yes, always. How are different, what would you try, what would you suggest to our younger generations who are looking to get into athletic training and who want to try to be of good service to our community just by mixing medicine and sports like you did?
Yeah, so the profession from the education side has evolved even since my time 13 years ago. So now it is an entry level master's requirement, not unsimilar to PT. Obviously, PT has now moved more to the DPT.
Mm-hmm.
But I got my undergrad in athletic training and I could have gone right to work. I chose to go back for a master's. Now you have to go through a master's program in order to become an athletic trainer. Yeah, it adds years of school, but I think it opens up a huge opportunity, especially for people that aren't in college yet or are still early in their college career. Because if there's a secondary interest that you have, it could be strength and conditioning, nutrition, mental health, and psychology, which is going to continue to be just a huge thing, especially in athletics in general, but specifically collegiate. If you can focus on that in your undergrad and come out with some skills or be ready, come out and become a certified strength coach, or depending on the state you're in, something with being a nutritionist, or set the groundwork for maybe another round of graduate school in mental health or around that area. You can finish that in undergrad, go get your master's in athletic training, and you can be a really big dual threat coming out of your master's degree to then go wherever you want to go and make an impact, because you'll be able to bring multiple facets to your job in comparison to others. I didn't understand all of that when I was going through school, and I really wish I would have. I think I would have done a lot of things differently. And
Right.
so that would be my suggestion there. If you like that option and you want to get into athletics, absolutely. But if you can start earlier and really prep yourself even before you get to your master's, you're going to be able to open up a lot of doors for yourself, just because you have that unique skill set.
Agree. When I did my master's, there were a lot more opportunities and a lot more people approached me for just for jobs too. So I believe like having better education and always keeping yourself updated with research, with technology, with new skill sets, it always goes a long way.
Yeah, absolutely.
Mhm. Is there any one interesting story that you remember from your time, from your career?
Oh man, I've had a lot of interesting success stories. One I always go back to, and it was just the kind of the power of collaboration. Is I was still in graduate school, but was working as a full-time athletic trainer. We had a very high-level pole vaulter, like could win a national championship level pole vaulter. Um, we were in the end of the outdoor season. We were coming up on conference championships, so that happens. 2 weeks later is regional championships, and then 2 weeks after that is national. So within a 6 week span, you have all the championships.
Right.
A week before the conference championship, he comes in and he goes, "I hurt my shoulder. It's bad. I don't know what to do." And so you're kind of not a point of the story, but we found out later. So he claimed he did it doing some workout, doing handstand stuff. Seemed plausible, whatever. Turns out he was trying to ride his longboard by doing a handstand and bailed out. So, irregardless, he still hurt himself. But
Right.
perfectly coordinated team effort of got him in, did the eval, got him to our team physician, kind of put a rush on an MRI to know what we were dealing with, got that back, showed some things, but it wasn't awful. There was some labral tearing, which may or may not have been there before. No major, like, huge traumatic rotator cuff tear or something along those lines. Still obviously painful and things we had to work to. So we had actually planned in coordination with the coach, we might just bypass the conference championships. Sucks for him because he had won so many of them, was the favorite to win again, but there was a bigger picture that year. But within that 2 week time period we had before that, between our treatment, work with a massage therapist, we utilized a chiropractor who was a soft tissue work specialist in ART, full treatment plan, got him to compete at the conference championships. He didn't have to do much and he won. Still was dealing with pain, but ultimately, long story short, through these coordinated care, we were able to keep him healthy, got him back pain-free, ended up winning his only national championship of his career. And it was all that more special because no, it was crap. Like this isn't going to happen because where he's at. It might have been his senior year too, just to add some drama to the story. But it was fun and fulfilling because it was such a coordinated team effort of everybody bringing their skill set to the table. Nobody's thinking that they had to be the one that was going to fix this by themselves. Everybody bought in, from the student athlete to the coach, which was a huge part of it as well, just all working together to make sure that we were doing what we could to get this person back. So that one sticks out in my mind as one of the more fun. And there was a few more of those, couple seniors that that had hurt their shoulders playing football, and all the effort we did to get them back for that one last game, and just their buy-in and the coach and the doc and just everything we could to give them that experience to be able to finish it out. Those are the rewarding times to watch people get to do what they love to do and do it well, and you just got to be a part of it.
You won the nationals though.
Yeah, I mean, that was pretty sweet. Yeah.
Wow. I thought, maybe one match, okay. But then he kept, wow, that's amazing. How much do you think all the group therapy works? Or is it actually like you mentioned, it's a joint effort? Or do you think it's more exercise therapy, physical therapy that helps? Or you would still recommend massage therapy, chiro, maybe dry
Yep.
needling, kinesio taping?
So I think therapy is the basis of everything. Good
Correct.
therapeutic exercise. I think that is second to none. And just what is going to quote unquote fix most problems. I think there's a time and a place for all of those other modalities you mentioned. I very much lived by, I like doing some soft tissue work, ART style, like using the instrument assisted, dry needling, cup therapy. I utilized all of them. I very much would always work with the athlete. Like if I knew on a given day I wanted to do some version of soft tissue work, but I was very indifferent to which one, I'd leave it up to the patient. You tell me what makes you feel the best. What doesn't make you get sore on any given day? So unless I specifically had a reason for doing one versus the other, which I would explain to them, I gave them that choice to be part of their healthcare plan and really wanted it to feel good and that mental aspect for them. Going back to the case that we had with that pole vaulter, I probably could have done most, short of some of the adjustment stuff, all of the massage. Was again dangerous enough with ART, but the chiropractor who did it is an instructor in it, so he is very good at it. I think some of it is that it was almost the special attention of we were having the specialist work on you for this specific reason that helped again back to our conversation about the mental and the psychological aspect of it. Of they're pulling out all the stops for me, and then I played my role. So instead of me doing a half-assed version of some of the stuff, I took care of all the other things, which freed me up to do other things while the specialists were taking care of those things. And I think there's definitely a role in that. And so when you get that team that's willing to do that together without the ego, not much is more powerful than that.
It's magic.
Yeah.
Yeah.
Exactly.
When a team works together, just doing their part of the job, it just works. It has to work.
Yep.
Any last words that you have for our all the viewers, everyone who is watching, and me too?
I was just having this conversation with somebody earlier today on the podcast we were recording. You gotta be open to everything that's out there. We talk about there's the evidence-based continuum or the evidence-based tripod, evidence influence practice versus kind of evidence-based, and a lot of that gets down into semantics and some nuance. But having that conversation earlier, back to that grad school example, yeah, I was the certified athletic trainer. I had passed the test. I had gone to the school, but I was a year or two into my career. I had no idea what I didn't know. Some of the coaches that I was working with had been coaching longer than I had been alive. Like they had trained at the highest level, competed at the highest level, worked with professionals all over the place. It would be insanity for me to not be open to working with them. Doesn't mean I'm going to defer all the medical stuff to them. I am the medical professional. There is a role for that. But to just not take into consideration their experience and their knowledge of their sport that I don't know anything about, because I never really, I ran track and field, but I was just there. Like I wasn't any good. To not take that in would just be naive of me. And so taking all of those pieces, and I try and think for myself, like I have some kind of structured principles of what I think works, but I have a lot of flexibility in those to venture outside of it on a case by case basis. And I think that's ultimately what makes you really good. I mean, I ask a lot of students this, and I'll finish on this, and I'd be even curious as your input, is, what makes a really good athletic trainer? What makes a really good physical therapist? Is it the amount of certifications you've done, or the letters behind your name, or the years of school? To me, it's you've got that whole continuum of rehab and care, and being able to figure out where you can drop somebody along that, and when to push them forward and when to pull them back, and just being able to see that whole picture is what makes somebody really good. And that's almost impossible to measure.
Right.
But that's, I think, where most of the power comes from in our line of work, from strength and conditioning to physical therapy and beyond. Is that's what makes somebody really good. And so be open to all of the different things, working with different people, trying different things, and never necessarily writing one thing off. Like kinesiology tape can be a taboo type thing.
Mm-hmm.
That's what works in a given situation.
Mm-hmm.
Is it bad medicine? I'd argue it probably isn't.
Mm-hmm.
As long as it's ethical and it's not going to injure the patient, I think you got to be open to potentially using it.
True. That was very insightful. Thank you.
In my semi-old age, I feel like I'm getting there.
I'm with you. I'm on the right behind you. Well, if our viewers want to reach out to you, where can they find you?
Yeah. So I'm on probably most active on Twitter, which is Joel.Luedke, so JOEL.LUEDKE. Instagram is actually Joel_Luedke. I don't know why I did them differently. I don't think I understood it at the time. But both of those places, for me personally, if you're interested in athletic training and just want to hear about some different people, the podcast is Athletic Training Chat is what it's called. And then the other interesting thing we do is we run a very early on nonprofit called Clinically Pressed, which has a lot of free resources that we're constantly working on putting together and hoping to put more to. So that's something that might be worth checking out as well. We interviewed some really interesting people there as well, but put together some different things that people might find useful. So those would probably be the most easy places to connect.
Right. Thank you so much for removing the time. Sending you so much love to your kids as well and to your wife.
I appreciate that.
Thank you. Have a very, very good night. And I'll stay connected with you. I'll keep asking you like a million questions, keep bugging you. Now, I know I have to bug you a little because on Facebook, it's not too easy to reach you.
Yeah, that's my fault for being a little delayed on that. I will promise to do better in the future.
Thank you so much, sir. Have a good night.
Thank you too.
Bye-bye. Thank you for listening to our talk about health. You can follow me on Instagram at bhavna.devnani, on Facebook at bhavna devnani, and we'll leave all the information in the description below. Thank you.